My name is Dr. Mandira, and Inito is helping take the mystery out of fertility. The Inito Fertility Monitor is a unique test that can track and confirm ovulation. This is especially important if you have certain conditions, for example, like PCOS. This measures estrogen and luteinizing hormone levels to predict your fertile days, and progesterone to confirm ovulation. Now, most other ovulation tests measure your LH levels, which is a hormone that can predict your fertile days. LH rises 24 to 36 hours prior to ovulation and then triggers ovulation. The rise in LH does not necessarily mean you have ovulated. Over 1 in 3 cycles can actually be anovulatory. An increase in progesterone levels in the second part of the cycle is what confirms that ovulation has successfully taken place. Most ovulation kits don't measure the actual value of your hormone. Instead, they have a set value or a threshold. And if you hit that amount, then a positive result shows up. But these threshold values may hold true if your hormones fall within that level. But it's an average range. If you're out of that range, you may actually get a false reading. Again, with certain conditions or just the uniqueness of your body, the baseline value of LH may actually be higher, like in PCOS. If the LH level is higher, this may give you a false positive in other tests. Instead of thresholds, Inito measures the actual value of hormones in your body and personalizes the results, hence reducing these false readings. You, of course, can download the chart of hormones and always ask your doctor to help you interpret these results. I'm wishing you happiness, health, and the best luck on your fertility journey.